Good day, I welcome you back. Dr. Scott, your online headache doc, the only doctor of any kind certified by both the American and International Boards of Commonsensical Medicine. Welcome back to Relief at Last, what your doctor won't tell you about your migraines, your headaches, and your ongoing pain. We're going to start diving a little bit deeper into what the medical research really says about the causes of your migraines and headaches. Not what our doctor's opinions are, but what does decades upon decades of proven, published medical research really say. Now, what I'm not going to do is just spew a bunch of medical research, facts, figures. Nobody wants to listen to that. But what I want to do is give you real, usable, practical information. You've heard me say time and time again, the only way that many are going to ever experience any significant long-lasting relief from their migraines and headaches is you must become the expert, because our doctors, in many cases, if not most cases, are completely oblivious to the decades of medical research that's been published. Your doctor's job, your therapist's job, your chiropractor's job is to treat or attempt to manage your migraine or headache symptoms. That's what they do. We've been convinced, you may have been convinced, I was certainly convinced, that there isn't a long-term solution for our migraines and headaches. It's simply a neurological disorder, and the only option is to manage the symptoms. That is not what the medical research says. It is contrary to decades of proven published medical research. Do not let your doctor, do not let your neurologist, do not let your chiropractor, do not let your healthcare provider convince you that there isn't a cause, that there isn't an identifiable cause for your migraine and headache symptoms, and do not let them convince you that there isn't a long-term solution, because that is contrary to the proven published medical research. So, when I share these details with you, we're building our toolbox. We're providing you with proven information, proven facts, rather than relying solely on professional opinions alone. My opinion doesn't matter. No professional's opinion really matters in and of itself unless it is backed by proven published facts. So today, the first thing I want to do is share with you the 6 most dangerous words in healthcare today when you're seeking help for your migraines and your headaches. And the 6 most dangerous words are, whatever you say, you're the doctor. Whatever you say, you're the doctor. From the time I was young, and this continues to be instilled in our generations even more so today, do not doubt your doctor's recommendations. Do not challenge your doctor's recommendations. After all, you're the doctor. Well, I've got news for you. Healthcare is a business. And it doesn't matter what's proven in the medical research. If your doctor recommends whatever method, mode, or type of treatment it is, you can bet that that is the mode of treatment your doctor is trained to provide and is trained to sell to their patient base. If you visit your primary care doctor, you can bet that you're going to receive a prescription in an attempt to temporarily mask your symptoms, because that's what your primary care doctor is trained to do. If you visit your chiropractor, you are going to receive, more than likely, chiropractic adjustment or alignment or manipulation because that's what they're trained to do. If you visit a physical therapist, you'll probably receive physical therapy. If you visit a pain management specialist, you're going to receive injections more than likely because that's what they're trained to sell you. That is the method and mode of treatment which is being utilized to attempt to manage your migraine and headache symptoms. Listen to this. All the while ignoring the real, true cause. All the while ignoring the cause of your migraine and headache symptoms. So, please, I want you to heed this warning today. If you don't know what the real, true cause of your migraine and headache symptoms is, it doesn't matter what kind of doctor or therapist you see. It doesn't matter what kind of treatment or therapy you decide to try. It doesn't matter if it's traditional medical treatment or quote-unquote alternative treatment. It doesn't matter until you first identify the real, true cause. This is a prime example of what I call commonsensical medicine. If you don't know what you're trying to fix, you, and you got it, your doctors are simply guessing with your health, trying the next best new and improved pill, shot, potion, gadget, gizmo, whatever the case may be. Stop trying things out, hoping you're going to find some kind of long-lasting relief. Focus, first and foremost, on pinpointing the real true cause. Now, let's dive into just a few. Some of these are more frequent, more recent studies that have been published in peer-reviewed medical and scientific journals. So, what I'm going to share with you today is just the tip of the iceberg. There are hundreds upon hundreds of proven, published medical, scientific, and clinical research studies that support the fact that your migraines and headaches may not be a head problem. Your migraines and headaches may not be a head problem. In other words, the cause of the problem may be just below that in the upper part of your spine and spinal cord, and not inside of your head. This is one of the reasons that we discussed previously that many of us have had MRIs or CT scans of our head that are seemingly, quote-unquote, normal. They are unremarkable. They do not identify the cause of your migraine or headache symptoms because you're looking in the wrong place. So let me share just a few of these medical studies and research papers with you here today. I'm not going to dive deep into the details of the study because, once again, nobody wants to hear me spew that information. But we're going to tie this together because understanding what decades upon decades of proven published medical research really says about the cause of your migraines and headaches will give you the tools to then formulate a proven, significant, long-lasting improvement. Now, I will say, some of these quotes with medical research, I have paraphrased, I have interpreted them due to time limitations during the podcast. First, the Canadian family physician. I liken the Canadian family physician to the American Medical Association here in the United States. And here is the conclusion of a study in recent years from the Canadian family physician. At least 70% of all headaches arise from a problem within the cervical spine, within the neck. So according to one of the more recent studies, at least 70% of us that are battling migraines and headaches do not have a problem inside of our head, despite symptoms being prominent in the head, but rather an issue that originates in the upper part of your spine. I would be willing to bet my left leg and my right arm that there are very few doctors, neurologists, pain management specialists, primary care doctors that are even aware of this published medical research. Next, this is from Spine Journal. Spine is a very well-respected and very well-known medical journal, which is also peer-reviewed. Peer-reviewed means before any research or any article is approved for publication in that journal, it has to be reviewed, edited by a board, which usually includes different types of doctors and healthcare providers. So not just anyone can publish in a peer-reviewed medical journal. So in the journal, Spine, here's what their conclusion is. There is anatomical, physiological, and clinical evidence that indicates, listen to this, that disorders in the structure of the spine are a frequent cause of headaches of all types. Let me say this again. Anatomical, physiological, and clinical evidence exists that indicates disorders in the structure of the spine are a frequent cause of headaches. Let's continue. Here's a medical research article by Dr. Rothbart, who is a medical physician of the Cervicogenic Headache Society. Cervicogenic means a problem that originates from the upper part of your spine, usually the neck area. And according to Dr. Rothbart and the Cervicogenic Headache Society, scientific evidence explains that abnormal structure of the neck can cause many types of headaches. So already, out of the hundreds upon hundreds of proven published medical research papers and studies, we already see 3 right off the bat that are all pointing the finger to the area of the real true cause of your migraine and headache symptoms, and it's not an identifiable problem, that is, inside of your head, but rather a structural disorder of the upper part of your spine, which results in neurological type symptoms. So those of you that have listened to my podcast for any period of time, that have read my books, know that my practice, my day-to-day clinical practice of nearly 32 years, I specialize exclusively, 100%, in migraine, headache, and specific upper spinal disorders. And those of you that have known me for any period of time know and understand that I just simply don't like opinions, and that includes my own, because medical research that has been published for decades is overwhelmingly clear. Yet, our doctors, even headache and migraine specialists, either are completely oblivious, they are completely unaware of this proven published medical research, or, I hate to say this, in some cases, completely ignore the medical research in exchange for their individual opinion. So, doctor, are you saying that 60 or 70 or maybe 80 years of proven published medical research is all wrong, and that your opinion is correct? I don't buy it. 70 or 80 years of proven published medical research points to one thing: structural disorders of the upper part of your spine that can compress the spinal canal, resulting in neurological symptoms such as migraines and headaches, among many others. Most migraines and headaches are not a neurological disorder, but a neuromusculoskeletal disorder, which is fancy schmancy talk for a structural disorder of the upper part of your spine that results in the neurological symptoms that you are experiencing. This is what the medical research continues to say and has continued to support for countless decades. Stop relying solely on professional opinions alone and become the expert yourself. Let me give you one more. This is from the Clinical Journal of Pain. Again, another peer-reviewed medical journal. Abnormal neck structure is highly associated with migraines and headaches of many types, but does not occur frequently in those without chronic headaches. Whoa, wait a minute. Abnormal structure of the neck is highly associated with migraines and headaches of many types, but is not found commonly in those without migraines and headaches. This also goes against what I have battled for many years among many medical specialists. I will hear things such as, everybody develops that particular neck problem. Everybody develops that particular disorder in the upper part of your spine. No, they don't. These specific upper spinal disorders are found primarily in those with ongoing migraines and headaches, not because I say so, but because the decades of research continues to support this proven, published fact. It doesn't matter if your doctor or your specialist knows this or not. Anyone can find this proven, published research if they're willing to take the time, energy, and effort to invest in your health. Look, I take this seriously. It's my job as a migraine and headache specialist to know and understand this published medical research. Unfortunately, our doctors of all types and all specialties are focused on one thing alone, and that is treating and managing your symptoms, all the while ignoring the real, true cause. So, we're going to continue to explore some of the proven published medical research and how that affects your doctor's decisions for your health, for your treatment options, and for your well-being. And why you must become the expert if you want a chance at experiencing significant, long-lasting relief from your migraines and headaches. There is no other way. You must become the expert and stop relying solely on professional opinions alone that differ, that conflict, and are contrary to the proven published medical research. So let me say just a couple of things in closing here today. Number one, if you don't know the real true cause of your migraines or headaches, chances are you may never experience any significant long-lasting relief, no matter what kind of treatment or therapy you decide to try or your doctors decide to try for you. And number two, there are countless ways that our doctors and therapists attempt to treat or manage our migraine and headache symptoms, all the while ignoring the real, true cause. Do not take that chance with your health. These spinal structural disorders are classified for the most part as progressively worsening. They don't get better with time. They continue to advance and frequently will end up resulting in long-term, irreversible damage to your spine And if you wait too long, then the cause of your migraine and headache symptoms can become unfixable. Don't take that chance with your health. So, if you continue, listen closely, if you continue to ignore the decades upon decades of proven published research in exchange solely for your doctor's opinions, now it becomes your fault and your responsibility that you're not finding the long-lasting relief that you're searching for and that I believe you deserve. Let me say that again. You are not allowed to complain about your migraines and headaches unless you are willing to do something about it. If you are not willing to take action and become the expert, you cannot ignore the research because otherwise you alone will own the consequences. Please keep up with onlineheadachedoc.com. We're going to be adding new features, step-by-step guides to help lead you in the right direction in your particular individual circumstances. The questions are always, well, that information is great, Dr. Scott. What do I do next? Where do I go from here? Please stay tuned each week. Thank you so kindly for listening to me. My job is, because I work for you and I work for those that you care about, my job is answer your specific questions, provide you honest, proven, published relief based on the research, not based solely on opinions alone. This is the reason that our success rate in day-to-day practice has been so high for more than 3 decades. It's not magic. It's commonsensical medicine. Please share this with somebody you know, somebody that you care about that continues to battle ongoing migraines, headaches, or chronic pain. The facts need to be shared in order for us to find significant, long-lasting relief and to live the happy, healthy, active lifestyle that we all deserve. I'm Dr. Scott, your online headache doc, and those are the facts. And everything else, well, it's just another opinion. The information contained in this podcast is not meant to substitute for your doctor or healthcare provider's advice or recommendations. It is based on Dr. Scott's 32 years in private practice so far, specializing exclusively in migraine, headache, and upper spinal disorders, as well as decades upon decades of proven published medical research. Copyright 2025 by Milagros Media, LLC, not affiliated with Dr. Scott's private practice.